Hi, my name is Dr. Ami Dakshini and I'm a dermatologist. So the question is exosome therapy for hair regrowth a science or just a hype? Hair loss can be frustrating, it can reduce your self-esteem and confidence, and it's extremely difficult to treat. And which is why there are multitudes of treatments available in the market. And how do we decide what is right for us? Today, I'm going to talk about the exosomes for hair regrowth. Let us understand what exosomes are and dissect how it can help and who is the ideal candidate. So, what are exosomes? Exosomes are nothing but tiny bubbles or vesicles which are very small in size, nanoparticles, which are rich in proteins like RNA, rich in growth factors, as well as healing or repair agents. Now, these, when injected into the scalp at the level of the hair follicle, it helps the hair follicle regenerate, regrow. It helps it to become more nourished, thereby making the hair that grows denser, thicker. So, these exosomes are derived from either plants or animals. Plant exosomes are derived from aloe vera in general. In animals, it could be fish or human. Human generally is derived from fat or adipose cells or from the umbilical cord. These exosomes, when injected into the scalp, can thereby reduce inflammation and help regrowth of the hair. The most popular treatment currently in clinic is PRP for hair growth. So, how does exosome differ from PRP? The first important difference is that PRP is from your own blood, which is centrifuged in the clinic, and the top layer, which is rich in growth factors, is extracted and then injected. Thereby, there could be some discrepancies in from clinic to clinic. But when it comes to exosomes, they are packed and available in sterile containers, and therefore the concentration is stable, and therefore we know its efficacy will be too. The other thing you have to remember about a PRP is that you need more frequent sessions and you need much more sessions to see the results because it's a very small layer that we get at any given time. Whereas exosomes, you can keep a longer gap and you need less number of sessions to see the results. Exosomes, in comparison to PRP, have higher chances of allergies because PRP is your own blood, whereas exosomes are external. Also, since it's a new form of treatment and it's a biologic, it's far more expensive than PRP. So make a choice, see what works best for you, and go ahead and do that. So, the ideal candidate for exosome therapy for hair are those with early and moderate signs of hair thinning. Could be even androgenetic alopecia or telogen effluvium because it works by hydrating and nourishing the hair follicles, thereby stimulating hair follicles as well as thickening the hair growth. Also, cases where there is a skin condition like lichen sclerosis or lupus, it can help in nourishing and regenerating follicles to some extent. It's important to note that the follicles need to be active for any of these treatments to work. So, certain cases we do not try and do exosome therapy. One, if there is superficial infection on the scalp, if there is scarring and cicatricial alopecia, and in pregnancy or lactation. Now, how are the sessions spaced? In comparison to PRP, as I said, the sessions are not so frequent. So, we do one session in every 2 or 3 months, and we roughly do 3 to 4 sessions, which thereby get completed over 6 to 8 months. Then we wait for the hair to grow, and after 6 to 8 months, we might do a repeat session just as maintenance. Because exosomes are concentrated, you see results faster and you need longer gaps between treatment. Now, certain side effects can occur post injection, especially if it's injected directly into the scalp and not done mesotherapy. There could be redness, there could be a little bit of irritation, and the next day, a little dryness or itching you can feel. Other than that, there are no other side effects. I advise you to do a patch test before you start doing exosome therapy in clinic because, as I said, it's a biologic. So, at times it can cause allergic reactions. In initial phase, you do notice some shedding, but this is considered good because all the follicles are now coming at the same level. So you see better hair growth. You can notice a little bit of dryness and itching, but which subsides. The scalp generally should be kept moisturized and hydrated to see best results. The results are best seen when you combine it with certain topicals at home. either minoxidil in cases of androgenetic alopecia or peptides in case of telogen effluvium. Uridensil, Procapil, caffeine will help in the exosomes working better and keeping the scalp more hydrated. A gentle scalp care will also help in keeping the exosomes in the system and helping the hair grow.